Bone is a living tissue which is made up of a variety of different cells. Some of the cells, which are called osteoclasts, are constantly breaking down bone, and other cells, which are called osteoblasts, are constantly forming new bone. And when the activity of the osteoclast begins to outpace the activity of the osteoblasts, then the bone can become progressively more weak. And if that occurs, then eventually someone can develop osteoporosis. Some factors that affect bone remodeling include advancing age, certain dietary issues such as lack of calcium and vitamin D, a lack of sun exposure, and lack of exercise, smoking, and even high sodium diets, because sodium increases the rate of calcium excretion. Bone density is assessed by doing some type of bone density test. Either X-ray or ultrasound can be used to make this assessment. X-ray is typically used, and we assess how much X-ray the bone absorbs, and that gives us some idea of how dense or how strong the bone is. And then that data, or the bone densitometry data, can be used to assess a person's lifetime fracture risk. An exercise must either be weight-bearing or strength-bearing in order to strengthen the bones. And the most common types of exercise would include things such as tennis, walking, weightlifting, or even aerobics. The bones that are strengthened are specific to this type of exercise which is being done, so it's important that patients participate in a variety of exercises to keep all of their bones strong. Osteoporosis is a bone weakening disease that has very gradual onset. In fact, the onset is so gradual that people often don't realize they have osteoporosis until they've suffered from a fracture. It's extraordinarily common. Approximately 25 million Americans suffer from osteoporosis. The majority of the patients are women, but there are approximately 5 million men who also suffer from osteoporosis. There are several things that a patient can do to diminish their lifetime risk of developing osteoporosis. One major point of focus is nutrition, and particularly focusing on adequate vitamin D and calcium intake. A second point of focus is lifestyle, including adequate exercise, especially weight-bearing exercise, as well as smoking cessation. And a third focus in women, which can help, is hormonal therapy, although there are potential risks and benefits to hormonal therapy, so you'd want to check with your physician. Weight-bearing exercise in isolation is not sufficient to prevent the development of osteoporosis. It's real important to combine exercise with adequate nutrition, especially adequate calcium intake. If one does develop osteoporosis, there is a substantial increased lifetime risk of developing a number of fractures. The most common fracture is vertebral compression fracture. Other types of fractures include hip fractures and wrist fractures. The primary symptom of a vertebral compression fracture will be back pain. Oftentimes the pain is very localized to the fracture level. On occasion the pain will radiate down into the right or left buttock area or down a leg. The pain is often so disabling that it's difficult for someone to walk or even sit in a chair. The first line of treatment is often conservative management, which would include a combination of rest as well as potentially physical therapy and pain medications. If the conservative approach fails, then there are minimally invasive treatment options available, including vertebroplasty. It's preferable to perform the vertebroplasty procedure within the first 6 months following the fracture. After that point, the density of the healing bone increases and makes it more typically difficult to perform the procedure. The vertebroplasty procedure is typically performed by an interventional radiologist using X-ray guidance. Specially designed needles are inserted into the fractured vertebra, and acrylic bone cement is injected, which will stabilize the fracture and reduce or eliminate pain. The procedure is covered under Medicare. The focus of the procedure is pain relief, and it's thought that the acrylic bone cement stabilizes the fracture, which decreases motion of the fracture and thereby eliminates pain. Prior to the procedure, our patients are often severely disabled and unable to do even activities of daily living. But following the procedure, we've had patients return to activities such as golf, gardening, and walking on a daily basis. If a patient is concerned that they may have a vertebral compression fracture, they need to speak with their physician and arrange to undergo spinal x-rays and potentially additional imaging tests such as MRI, CT, or bone scan. If they are found to have a fracture and want to talk more about this potential treatment option, they should be referred to an interventional radiologist or another specialist who performs this procedure. There are also some websites available, including www.vertebroplasty.com.